Thanks very much. It's a privilege to talk about the hospital. Albert Einstein is a hospital, but more than a hospital. In recent years, we've been expanding our activities. It's considered one of the best hospitals according to the Newsweek ranking. And at the moment, we are organized in a way that we provide health assistance, education and research, and innovation. And this is according to a proposal that has been devised a long time ago, almost 50 years. And through the years, Brazil has been experiencing the activity of this hospital in many different areas, most of the time as a pioneer. In regard to our social responsibility, we've been engaging in many programs together with the government and with the other partners in the private sectors. And this is actually the numbers, I'm sorry it's in Portuguese, but this is the amount of investment that we've been working in programs related to the improvement of health. And this is, again, not only related to our activity, but also in the society as a whole. So I would bring the attention for a few areas that we've been working with technology. And in those areas, I'm going to highlight a few of those areas in the following examples. So just to give a broad perspective, activities that we do in the hospital are not related to those that have access to the hospital, but in programs related to our social responsibility and renovation. So the majority of people that are taken care by our professionals are now those that are not related to the small percentage of the population that can afford access to private sector. This is actually an overview of my example. So in terms of hospital beds, the private part of the hospital takes care of 626, whereas the public health, it's 775. The number of days in the hospital is, of course, is relevant. And this is related also to the complexity. The satisfaction from the patients actually is higher in the public sector. And also in terms of total number of exams, we perform more than 3 million exams per year last year in the hospital. I have just to highlight one point that we work actively in the COVID pandemics, building a hospital in the city of São Paulo with 200 beds. Another numbers, just to give you another example, in terms of emergency room, we have more than double the number of patients that we take care of in the public sector. The number of consultancy and telemedicine, and also the rate of occupation is actually very efficient in both hospitals of both private sector and public sector. So now going to the more specific technology, the way we organize our data, we've been working big data since 6 years ago. We have these 3 dimensions. All of them are centered in the subject. So we have data pertaining to the omics sector, so biology. For instance, we have data that we collected in research in epidemiology-based sample with whole genome analysis that's also available for research. And also we've been working on the ambient data that contains information provided by the subjects, again, following all the regulations in place. That belongs to the behavior sector. In other words, how people make decisions is simply implemented in our data lake system. And these are data that we use to propose of bringing data culture to our institution and to our partners abroad. So I'm going to show you via examples some of the ideas that we implemented using a concept of hub and spoke. So it's not like a client-based. We teach people through the use of big data analytics. We have been doing some analytics that's based on prescriptive and predictive analytics, and also content-based image retrieval. So the overall view is that we have to generate value to the society based on the journey that one has to follow when implementing solutions based on data. So data as an asset, but through analytics and AI, we can achieve the value. And through the process, we generate knowledge, and we also provide a global connection in the process. So the examples I'm going to give you is a set of 3 examples within a hospital and 3 examples outside the hospitals. One is more predictive and prescriptive analytics. The other one is predictive analytics. The first example, which is a kind of routine, when you go to a surgery, the surgeons, they have to use a lot of instruments that have been either sterilized or produced uniquely for that moment. So we have this amount of complexity and instrumentation used for a particular surgery. So we took the data from more than 240,000 surgical procedures, comprising around 6 million instruments, and we use an algorithm to optimize what's the best combination of instruments for each particular surgery for each particular type of patient. So we're using that intelligent solution, we were able to reduce the cost of the procedure in a certain case up to 32%. And this was based on 3-year operation system. And this solution actually it's actionable because the ones that are managing the system can select what's the best optimization method for each day. In other words, you have a kind of seasonal movement in the hospital, and this system can actually adapt to what's the best solution for a particular day. The second example is based on images, medical images. The hospital has around 1.2 petabytes of data only solely based on images from patients. So what we did here was to select a method using AI that could identify one part of the aorta and measure this organ in all images performed in our institution. In other words, we have the database that can provide a search-based, content-based search engine, which is similar to what people are now using when they have photographs in their mobile phones. But the question here is whether this patient has a lesion or an anatomical feature that can be similar to what other patient in our, 2.9 million patients in our database. Those patients that were treated, they provide a memory of the medical condition that can be assessed in a way that is easy when you do these elements for search and retrieve the data. Another example is to predict who is going to come back to the hospital after a discharge in less than 30 days. This is a kind of well-known algorithm for prediction of readmissions, and we have implemented that back in 2016. That helps doctors to evaluate what's the best care for each patient. So this is individual prediction for readmission. And what you see here in the bottom line is the performance of the algorithms across 90 days. And in a daily basis, you see that certain dates, we are 100% correct. In a certain dates, we are less than that. On average, 87% of accuracy was achieved. So these are the 3 examples I gave. Now I'm looking at the population because I think it's more relevant to overall context in the society. One first example is prediction of metabolic syndrome. Metabolic syndrome, as you might know, it's a condition that actually is associated with one of the major causes of death. So metabolic syndrome is a condition that actually predisposes the subject to develop cardiovascular disease, diabetes, obesity, and even cancer. So the amount of resources that the public system allocates to treat those patients, it's enormous. And of course, the consequences of not treating these people, it's even worse. So the idea here is to build an algorithm that can predict whether a patient has a higher chance to develop metabolic syndrome. We use that based on AI. We use a combination of 28 different network systems. And this is just an example whether you can look at patient's history and see this in this column, the prediction of particular variable, in this case, abdominal circumferences, the arterial pressure and other measures. And this is the accuracy of the model for each of those predictions. So this guides the doctors to tell the patients, and of course, this system is not 100% correct, so he has to deal with that. Another example is the cost population management. This is an example that's a geo-reference-based system in which we look at where are the people that needs more assistance. And of course, we also want to simulate what would be the solution if we add more nurses or doctors to the system. This is seen on the right, where we can work on predictive simulation. So this is a condition in which we simulate based on real data what could be the effects on cost effectiveness of adoption of new systems in the city of São Paulo. This example was done in combination with the mayor of São Paulo. So the city of São Paulo, the largest city in Latin America, as you might know, has a programs that in which we work in combination. We take care of around 300,000 people. We manage the hospital and basic care units. And here we did a project on predictive analytics, trying to look at what would be the number of consultations per patients with hypertension and diabetes. In other words, we try to predict how often these patients will see a doctor, and if we can optimize these methods in order to make sure that the team is available for them when they need it. More than that, we want to keep these people in their homes in better healthcare other than just going to the hospital, which is much more costly. And of course, it's not the best situation for them. In other words, avoid complications. So we did a model that could predict with the accuracy of 0.88. One is the best accuracy, whether they would go up to one consultation per year, between 2 and 5, and more than 5. So we can identify the overusers and the underusers according to the prescriptions. More importantly, we did this in combination with the population and in combination with the healthcare workers that are attending the population directly. So we went there. These are scientists from our team going and visit them in these units in the city of São Paulo, this outskirts of São Paulo. So one interesting point here is that we could predict the frequency, but what they wanted to know in reality is when is the best date for consultations? A very practical, simple question. When should I schedule the appointment? That can be done using predictive analytics in order to get those that need more often to the doctors. So the last example I'm going to give you was a project that we made in the last 2.5 years with the federal government. And this was a big data analytics that was following the plan for digital health in Brazil. So the idea that we did here was to look at different contexts in Brazil and provide different solutions. There are many examples. We provided an index of geo-referenced socioeconomic risk for Brazil. We also tested technology based on social media network that is available. And we have a few publications in place and some that are still going to be sent. But basically, what we did here is to try to show to the government, in combination with the teams of the government, those that are working in the units at the basic care level, at the primary care level, in order to see whether they can adopt solutions, what are the barriers for digital literacy, and the solutions that we could provide, I hope, can help the government to reduce the inequalities that we see in our country. Thanks very much for your attention.